Throwing injuries. So there's one blanket statement that I want to put over throwing injuries. If you have poor throwing mechanics, it does not matter what I can do for you, what anybody else can do for you, your pain is going to come back. Oftentimes I see people in physical therapy in here in my office, and they come in with pain at their shoulder and their elbow. And one of the first things I'll ask them is, how's your throwing mechanics? Have you ever had them checked? Because I can get them stronger, I can get them longer, I can increase the flexibility of muscles that need it and increase the control of stuff. And that'll work for a short amount of time, but if their throwing form isn't addressed, then there's going to be too much stress on areas that aren't supposed to have that stress, and there's going to be a breakdown of tissue, no matter how much strength or stability or flexibility I can give you. Okay? So get your mechanics checked by someone that you know and trust. If you need help with that, let me know. And if you're a pitching coach, I'm always looking for knowledgeable people on this subject matter. I'd be curious to hear from you, so feel free to reach out in the contact form. But that's another topic on itself. So throwing injuries, I'll start down at the elbow. The elbow is the most common place that these throwing injuries happen, so the elbow and the shoulder. Oftentimes, elbow problems happen due to issues at the shoulder. Now, what I want to say is there's a couple areas that we know that create problems at the shoulder and the elbow. One of the main issues that happens at the elbow is the Tommy John ligament right here. It's on the inside part of your elbow. It's called your UCL, or your ulnar collateral ligament, and it's like this triangular shape right on the inside. And that area gets damaged when there's too much opening, like a gapping or a opening stress on the ligament there, so it kind of stretches it open. And it usually happens when you come from this late cocking phase and you're starting to come into acceleration. But it can also happen in the deceleration phase as well. But what happens is this ligament kind of gets stretched open, and over time it starts to get thinner and thinner, and then it starts to rip. You can also have injuries on the outside part of the elbow. So if you have laxity that's happening on the inside part of the elbow, you're going to have more compression on the outside. You can have little fractures of the cartilage on the head of the radius in here. You can get this other syndrome. It's called valgus extension overload. So again, if you have too much laxity on the inside part of the elbow, you're going to get little like arthritis growth where the elbow kind of locks into the socket here. So the ulna locks into the humerus, and if you have some laxity on the inside, you get this kind of knocking around of the bone on the back side of the elbow. Often hurts when you rapidly go into extension, so hurts when you're coming through and you release the ball. Hurts on the back side of your elbow. If you just rapidly try to straighten your elbow and you get like a pinch right between the bones here, that's a good chance that's valgus extension overload, and it could be due to your mechanics, it could be due to other things. So moving up to the shoulder, one of the primary things that we look at the shoulder is your total arc of motion, total arc of rotational motion at your shoulder. There was a pretty good study by Kevin Wilk just a couple years ago that showed that if you have a loss of even 5 degrees of total arc of range of motion at your shoulder, you're at risk of significant injury or surgery at your shoulder and your elbow. What that is the arm that you throw with, you're going to have more external rotation, so you're going to have this arm kind of kick back more because you're always wrenching it towards the back. So you're going to have more external rotation on this arm compared with your opposite arm. And then because you have more external rotation on this arm, you're going to have less internal rotation on this arm compared with this one. Okay, so that's kind of what you might expect in a way. So this is you're okay to look like this as long as this total arc of motion, if we measure that, equals the same as the left arm or the opposite arm. Okay, it's completely fine if you're like this. Okay, those arcs need to be the same, and if they're not, it's a problem. So you can have, usually it's caused by loss of internal rotation, so the muscles on the back side of your shoulder which are responsible for decelerating your arm as you're following through. Those get a ton of a workout, and they get really tight, and they start to limit your internal rotation. That can put stress on your elbow. It can cause all kinds of problems at your shoulder as well. What we're learning about now is more there can be tightness of your external rotators as well. And that can be due to your lat or your teres major muscle, which is a small version of your lat. So in addition to looking at your rotation motion, we also look at how much you can lift your arms up overhead. And if you look something like this, you can get your opposite arm way back, and this arm not. The arm that you throw with, you can't get that all the way back. There's a good chance that there's a restriction in your lat or your teres major. We can measure teres major on your side, but if that lat, so your lat is a very powerful internal rotator, so it helps you power through to throw hard. And if that muscle is getting active over and over and over again, that muscle is going to get tight, just like the muscles on the backside of the shoulder. If that muscle gets tight, that's an internal rotator, then it's going to limit external rotation. And so if we get limited external rotation, the body still wants to get this arm back here to be able to get good layback, to be able to throw hard. So what's going to happen is your shoulder will stop here, and then your elbow is going to start to gap open. And that's how you get more stress on the inside part of your elbow. That's how a shoulder problem can cause an elbow problem right there. So in addition to that, there can be problems with core strength, hip strength, hamstring strength. All of these things, control at legs when you're squatting, all of these things can contribute to increased stress up the chain. So if you're interested in throwing injuries, I encourage you to check out the baseball page, the baseball performance page. There'll be a link to it below the video here. And I hope you learned a little bit about injuries at the throwing shoulder and elbow.